and great to see you all. And today I'm really excited to introduce one of the former GloCal fellow, Dr. Luis Menacho. So let me say a few words about Dr. Menacho, and then we can get started. And hopefully this is going to be a towards the end opportunity to also ask him some questions as well. So Dr. Luis Menacho is a medical epidemiologist who obtained his medical degree at University Cayetano Heredia in Peru. And he also got his master's degree in public health at the University of Washington in Seattle. So he returned to Peru in 2010. And since then, he's conducted a lot of research on HIV prevention with an emphasis on the use of information and communication technologies for improving the continuum of care. He's trained in health communication and implementation science and has worked in both private and government-based research institutions. Notably, he was a GloCal fellow in 2013 and 2014. So it's been quite a few years. And he was able to continue doing research in areas of interest, and we should congratulate him. In 2020, he obtained his K43 award. So I'm sure he has lots of great experience and insight to share with us. So without further ado, and I would say that his current research aims to improve the retention and HIV care among HIV positive gay and bisexual men in National Hospital in Peru. So area that's really important and an important work that you're doing. So welcome, and I'll turn the floor over to you.
Thank you so much, Jay, for the introduction and the invitation. And thank you, Liana and Kimberly, also for inviting me. So I will start sharing my presentation. And can you hear me well, right? Okay. And I'm going to turn off my camera while presenting, so I have a great connection. And feel free to ask whatever you want during my presentation, or also at the end. Okay, so my name is Luis Menacho. As Jay said, my friends call me Lucho in Peru. So I would like to start telling you something about, more about my background. I'm a general physician in my country, in Peru, and well, after we have a different system in Peru comparing to the United States. For example, when we finished the medical school, we enter into a transition in which we have to decide what we're gonna do next. I mean, it's like starting again, sort of. And a lot of people, at least people from my fellows at the medical school, many of them went out of the country at that moment to the United States or to Spain. So in that process of finding what specialty I wanted to do, I started also in Peru, as in many countries, we have to do a rural service, which lasts 1 year, in which you go, it could be in your city or at other city in your country, and work for 1 year as a general physician and provide services. And after that, while waiting what specialty I was going to do, I had the opportunity to start working at the Peruvian NIH. I decided to start working while waiting what was going to be next. So I was lucky to find a job at the Peruvian NIH, which this is the picture you can see there. It's one of the buildings of the Peruvian NIH. It works different than the NIH in the United States, but it has some similarities, of course. So I started working there as an assistant of the management, which which meant at that moment like doing like everything, a little bit of everything. Actually, the the chief of the NIH at that moment was Dr. Patty Garcia, which some years after she became the Minister of Health. And I helped her working in many areas. At that moment, this is the first approach I had with public health. I had never been involved in public health until I started working here. And I think, and I mentioned this because I think this was very important for my career now. Nevertheless, at the Peruvian NIH, I was working more. I used to work more in the health administration arena, which is quite interesting. But now I'm more like a researcher. But anyway, at the Peruvian NIH, I was able to work in different areas. As I said, I did a little bit of everything, assisting Dr. Patty Garcia, the chief. In different diseases, I was involved like in a lot of different projects, different working groups, which is very complex and interesting because the NIH, the Peruvian NIH, it's a government-based institution. It belongs to the Ministry of Health. So thanks to this experience, I started thinking about following a career in public health. And actually, Dr. Patty Garcia was very important at that moment. So right during at the end of my job here at the Peruvian NIH, and with the support of Dr. Patty Garcia, I applied for a scholarship, and I got a scholarship from 2008 to 2010 in the University of Seattle in Washington through a Fogarty training grant. The International AIDS Research Training Program. I earned an MPH degree in Seattle, University of Washington. And what I always say is that I gained a lot of new skills to become a researcher. Before this, I didn't know exactly what epidemiology and being a medical epidemiologist was. During the medical school, we had research courses, of course, but when I was at the medical school, it was not too well strong and good as it is nowadays. But at that moment, we had only some basic training on epidemiology and research. But after being in Seattle in this great program in the School of Public Health, I really learned at least the formal training you need in terms of epidemiology, biostatistics, environmental health, etc. That supported me to become a full-time researcher when I came back to Peru. So I consider myself as a medical epidemiologist. I mean, there are many ways to say it, and sometimes I say I'm a public health physician, or but I guess this is what more describe me the best. I went back to Peru in 2010, and I have been, since then I have been in different institutions and projects and jobs. I have worked at NGOs, at community health centers, and mostly at the University Cayetano Heredia, which is my home institution, is where I did the medical school. Unfortunately, I was able to come back. I'm nowadays my current position is as a junior faculty, thanks to the K43 award at this university, UPCH, in where I have been able to do HIV research, improving the HIV continuum of care. I do a lot of information and communication technologies to improve health, to promote health, and also in the last years I have been involved in implementation science. So I would like to keep moving forward and tell you something about key topics I think that have marked my career, and see how this can help you. So one of the core for my career is actually mentoring. Since I started this at the Peruvian NIH. I have been working with different people. I say a diversity of mentors with different kind of support in different areas, skills, etc. And there are some pictures. Of course, there are much people around there, but I chose for this presentation these people, and I'd like to tell you something about each of them. Not I'm not planning you to remember the name actually, but what I want to do is to talk about some features or characteristics of each of them that I see are good to me as a researcher, that and how they can help, how they have helped me throughout my career. So Patty Garcia is the first people in the picture. She's a super smart woman, researcher, physician, epidemiologist as well, Peruvian. She's the one who was the chief of the Peruvian NIH when I entered there, and some years after that she became the Minister of Health. And so I see her as a very important person, especially in the first years of my career, because she actually introduced me to public health, and she helped me to go to get the scholarship for going to Seattle. So she promoted my career in public health, and I see her as a very good example of, I mean, she's in love with public health. I don't know if you if you get that. And working with her helped me a lot to get in some way also in love with public health and this area. So the next in the picture is Joe Zand. He's a epidemiologist and neurologist as well. He's based in the US, in Seattle, University of Washington. And he was my first mentor in the United States. And he has been providing me support throughout all my career, even nowadays. I'm still working with him. He's one of my collaborators in the K43 award. And he provides me different kind of support. I mean, sometimes he helps me to review a proposal or a manuscript, but also he helps me a lot with logistic issues when I have to go to Seattle. He has helped me to connect with people that help me with the documentation, etc. And he used to live in Peru a lot of years ago, so he's very well connected to Peru, and he has a lot of projects with institutions here in my country. So I am very happy also to work with Joe. The next one is Magali. She's a colleague of mine. She's also a physician in Peru. And what linked to me some years ago was actually that we were working in the same area. We had the same interests a lot of years ago. She's still working on mobile health using information and communication technologies. And at the beginning, that was a key point for me to start working with her, because at that point she used to work also with vulnerable populations, such as men who have sex with men. And so we started working together. We're still doing some things together, but she also helped me a lot in the transition of choosing a topic and a sub area I would like to work in. So she helped me a lot with that. Larissa is a colleague. We went together the last year of medical school. And what I also like to say is that she's like a peer mentor. I think that mentoring is important not only from mentors that are, I mean, that have much more experience than you, or are like super ahead of you, but Larissa is my peer. We actually are in the same working group, and we have walked together in our careers. Actually, she got her K43 award 2 years before me, and she helped me a lot with my applications, and in other areas here we have worked together doing consultancies here in Peru. So I see very valuable this peer mentoring you can get from your fellows as well, and not only from people in other levels of their careers. And next to Larissa is Elsa. Elsa helped me. I have been in different positions here in Peru and different working groups. And Elsa helped me a lot to get into this new working group I'm working right now, which is a very important working group here in Peru. And I thank to Elsa a lot that this transition to my the last position I have. Sorry, I guess I see
Oh,
oh
Luis,
yes,
just please
yeah.
go on. I was just chiming in, and I think this is definitely a very important aspect of building your career, especially
Mhm.
early in the career. And I think your point about showcasing and demonstrating all the different colleagues that you had throughout your career, I think it's a really important point. So please go
Thank you,
ahead.
Jay. Thank you, Jay. Yeah, and yeah, I think also it is very important. Dr. Eduardo Gotuso, which is in the bottom of the picture, he is a very prominent figure in Peru and in the region. Some of you may know him, and he's the one who provided me this strong institutional support to get the K43 award from the university, from as a country level, as Paracas, which is the big research project he leads. And and the last in the picture is Anne Duer. She's my current main mentor for the K43 award. She's based in the United States, in Seattle as well. I say she's the best because we have matched very well regarding our interests, our even the way we communicate each other. I met her in Seattle when I went a few years ago for a course, an implementation course I took in Seattle in 2016, I guess. I met her there, and then I found out that she had many projects here in Peru, uh, more in the clinical trial arena, but anyway, she was very well connected to Peru and with the population I work with. So then after that, I asked her if she wanted to be my main mentor for the K33, and fortunately, it's been a very good match. So let's keep going. The other important point I would like to mention in this presentation is Fogarty in general. For the Fogarty International Center has been very important for my career in terms of research and training support. Actually, the MPH I got in 2008 was through a Fogarty program, and then I have been a fellow also thanks to the Fogarty Center, and also I have been involved in other research here in the country that Fogarty has been the supporter. Fogarty has a very strong collaboration with Peru, with the university I work now, Cayetano Heredia, and definitely this institution has strongly supported me for moving forward in my career in different aspects. There's one picture in the top in one of the orientations I participated in Fogarty when there were no consortiums. I went through the University of Washington in Seattle, and in the bottom there's a fellow I met from Uganda. We went together to the MPH, and then we met up again in a Fogarty orientation, Thomas. And then, of course, this was the most recent. I got the K award, the K43 award. I will tell you a bit more later, which is also supported by the Fogarty Center. I got in 2020, and also all these opportunities I have received from Fogarty have been an incredible way to network with more people. I mean, locally and abroad. Uh, and I have to mention, of course, the GloCal. So there's one other picture I found looking in my gallery about the orientation we received in 2013 when I was a GloCal fellow through the USA consortium, and this was very important for me. Also, it helped me to move forward in the research area, because when I decided to start working with HIV, sexually transmitted infections in vulnerable population in Peru, then I kept looking for projects to make that stronger. So this fellowship allowed me to keep doing that. Actually, we had a project in this time. We proposed to explore more about bisexual men in Peru, because sometimes interventions are here designed for all MSM, men who have sex with men, and they put everyone in the same bag. And we found out that there were some gaps regarding, for example, bisexuals. So with this small project, we did an exploration among them. It was very interesting. And also, I see this as a very important support for consolidate my experience here in my country, and also actually providing me opportunities for getting new jobs, because you are more experienced, have more projects in your background. And this has helped me to work, for example, for community health centers at the NGO day I started work. And also, and very, very, very important, is that here in this orientation, I met my very good friend, Kimberly Bell, who is actually in this room as well. And Kimberly, I think this is a great example of networking, I would say, because besides being friends, Kimberly was one of the important persons that helped me to review my K43 award application. And without her, I wouldn't have made it. I have to say that. So another important point is the continuous learning I would like to mention. Yes, I agree. So I think this is an important thing, that the way we learn throughout our careers. And you also may know that this one is, of course, the formal training. For example, the one I mentioned, I got in the School of Public Health in Seattle. But also are other ways to do this now, especially in this technology era, and we have online courses, we have webinars, we have conferences. In my experience, I have learned a lot with the different jobs I was able to be involved in, actually in the government based level. Also, I used to work for one project in a community, a local community center, which is different from research center, but you can learn a lot. You can learn a lot by working in community-based organization. Also, I used to work at a local NGO here in Peru, and now in the academia, I'm attached to University of Cayetano. But I guess that accepting at that moment, at some point, different small jobs, or not that much small jobs, different kind of institution, I think that have enriched my career a lot. One important point is teaching. At the beginning, I was very resistant to get involved in teaching, and it's because I respect a lot the professors I have had, and I think that you need to be very well prepared in order to teach something. So at the beginning, I was always trying to say, no, I prefer not to provide this lecture or whatever. But after time has passed, I have get involved within my working group in providing some specific lectures in the topics I have worked, such as information and communication technology, mobile health, HIV prevention, and teaching is a great way to learn also. While you are preparing all your materials, you learn a lot. So don't be afraid of getting involved in teaching. And also becoming a mentor. Also, I have been mentoring undergrad students. I mean, before the case especially, and this is something. This is a good means also to continue learning within your career. So regarding collaboration in international setting, I have been always based in Peru. Nevertheless, I have worked closely with researchers in University of Washington, but my projects have mainly been in Peru. Currently with the K43 award, I'll let you know something more later. We are testing we're testing a web-based system for improving the follow-up of people living with HIV who have started treatment. And it's very interesting because this system, which is called WellTel, has been used successfully in Canada, in the United States, in Africa, and other settings as well. And not only for HIV, also for other diseases such as tuberculosis, but it has never been used in Spanish. So we are now translating, of course, the platform, but we are going to start soon this project, and it is the first time it is going to be performed in Spanish. So I think we are excited, but they also are very excited about how it will work, because this they are very confident that this might be the first opportunity to introduce their platform in Latin America and in Spanish. So we'll see. This is being done with researchers from University of Washington as well, and from University of British Columbia. Where I had the opportunity to actually work, did some work abroad. It was when I was working in an NGO, the NGO Via Libre, which means freeway. It's a Peruvian private NGO here, which has a very strong community-based component in which they provide services, and also it is a clinical, it is a research centers that do clinical trials. But when I used to be at this NGO, I was involved in a project they had with the International HIV/AIDS Alliance from the UK, and they have this this network of organizations throughout the world, through which they provide support to the community to improve the continuum of care. Not much from a research, not much doing research, but creating products, services. For example, Via Libre has been successful in implementing new services, so they try to teach their modules to see if this could work in other parts of the world, etc. So thanks to this project, I was able to work with people in South Africa and other countries in Latin America, but with a community-based approach. I was in South Africa with colleagues doing some qualitative collection research, and it was a very rich experience when I was here. I learned a lot. So now regarding grant funding for research, as I mentioned, Fogarty has been crucial for this in my career. In the past, what I have to say here is when I went back to Peru, and I guess this could be important. There's always a timing where you are like in a transition. You're looking for where you're going to be, in what institution, waiting for jobs, of course. And what I did since very early was trying to apply to any grant I could. Seriously, at the beginning, I have applied to a lot of small grants at the beginning, of course, but I tried many times. Of course, I didn't get many of them, but I guess that helped me a lot to improving my skills for writing small grants at the beginning. And then I got one from Grand Challenges Canada some years ago, which was also important, doing some information communication technology for improving HIV testing. But what I'm trying to say is that at the beginning, you need to be persistent and try different attempts to get that, and then find that depending on what you are, in what area you are working, in what country you are working, there are some funders that are like focused more on where you are and what you are trying to do research. So in 2020, I got the KE award. Through this project, the research component is improving the HIV retention in HIV care using information communication technologies. We're working at Cayetano Heredia Hospital, which is a government-based hospital here in Lima, the country's capital, which seeks a lot of patients. It has more than 7,000 patients on their program. And here in Peru, although HIV is low in the general population, the prevalence of HIV here in the general population is less than 1%. Among men who have sex with men is high, is around 12%. So it's very high compared to the general population. And we have seen that although the treatment is provided for free and it has improved a lot in the last years, we have seen that a lot of people get lost from the continuum of care at year 2, starting at year 2. So we're trying to implement strategies, solutions to improve that, and especially that now we have seen after the pandemic that all regarding technology the use has increased dramatically. So telling you the story about this, I tried this opportunity grant 3 times. I have to say that the first time was a lot of years ago with a different idea, with an old idea. And then I applied, I didn't even receive a score because I didn't take much time to prepare this first proposal because I was in another job, I didn't have much time. So I didn't get, and then I waited. There was a pause of 3 years approximately, after which I decided to apply, but like trying to do a strong proposal. So with a new idea, I came the second time, which received a good score. And then the next year I went for the resubmission, after which I got the award. So some tips maybe I can give you. I think this could work from some of you or not. I think you really need to focus at least the first time. And I say that at least the first time because the first proposal took me a lot of time, a lot of time. Of course, the resubmission, it wasn't that difficult because you need to address what they think it was not good. And I have to tell, for example, I quit the job I had at that moment, but it was for strategic reasons. It was not only because of the grant, it was because of time, yes, at the beginning, but it was also because this job at that moment had changed and I wanted to focus on behavioral research. And at that moment, that job was focusing more in clinical trials to try new medicines and vaccines, which is great and super interesting, but my interests were more doing behavioral research. So I decided to quit strategically, and of course to prepare the second new idea, which finally 1 year after was granted. Another important thing that have worked for me is optimizing the support of my team. Sometimes, and this happens also with, I guess, with publications, when you try to have many people to review your whole proposal, it takes much time, and you can get distracted from what you are trying to do. And what it worked better for me is having one mentor reviewing this and the other that, and one of my fellows and my colleagues doing this specific area, or so trying to get what you need from each of them, but in the best way you think they can give it to you. And also for this kind of grants, it's very important to be strategic when you're choosing your team and your training plan. I don't know if you have been involved doing this application, but it is very important the team you are choosing. It has not to be, you should not choose a lot of mentors and also not too few mentors. So the number of mentors is also important, and your main mentors have to be people in some way you have been involved with. Otherwise, they could say, what are you working with him or her for the very first time? It could be, as it happened with me and Anne. I had never worked with Anne before. Nevertheless, she had a strong connection with Peru and the population I was planning to work. So that was a good match. And also she belonged to UDAP, where I had worked before. So you need to be strategic for choosing your team, and also the training plan, because these kind of grants have a very important component about training, and you need to show them why you are choosing this or other training. So you need to think about your gaps and your project as well, what training you need to complete your project and to keep moving forward in your career. And also, I would say reading well what reviewer said. Sometimes we get with one idea and we think it's good because our mentors have said that it is good, and how this reviewer might have not understood what I was trying to say. But you need to, at least when you are going for the resubmission, you need to address point by point what they have said. Even if you don't agree, you can say, I disagree, and they have not understand, but whatever, it is important to not miss what they are saying. So almost entering to the last slides, something about publication and dissemination. I want to start saying that it is not easy. At least for me, this is one of the publication in peer-reviewed journals. It is a hard work for many reasons you may always also know. What I'm learning in the last years from my mentors is that avoid trying to change the world with a single manuscript. Sometimes we want to say everything. We want to, because in our survey we collected much more information other than the main outcome. We are trying to put like a big project, and the other day my mentor Anne was reviewing one of the papers we're trying to push, and she, after reviewing, she deleted 2 paragraphs from the introduction, and she said, I mean, it is not necessary to put all of these. Yeah, 3 or 4 paragraphs, 2 or 3 ideas, it's okay. And we kind of know that, but we lose the direction every time we are trying to write a new manuscript. So you need to focus on your main results, and not only in the results section, but also in the introduction and the discussions. Keep focusing on your main results. This is not easy. Depending on who I'm working with for a specific project, I guess you need to find the best way to work. With some of them, it works, for example, having meetings like this and reviewing the paper, like sharing the screen. And sometimes it works, each of the colleagues reviewing by themselves and then send it through email. I guess that would depend on the group. And the other important point is that scientific journals are not the only means. Of course, we need to keep publishing in peer-reviewed journals, because it's one of the ways we ensure that we are being we are like passing through this peer review process in terms of quality of what we are doing. But also there are other means we need to learn to use and to be aware. Of course, you know, one important is social media. We have seen during this pandemic how strong, how powerful it could be standing up by a microphone or a channel and talking about public health, about diseases. So it is a good idea to try to find training for doing this, for social media training, or to designing materials for sharing in social media. Of course, conferences, presentations, courses. There are other ways to share your results, and sometimes we are waiting for the journal to approve our paper before releasing our results, but there are other ways we can share before waiting for our publication. So this is the last slide, and this is actually a joke. This is how nowadays I'm trying to balance professional and personal life, but no, it is not true. But the pandemic has changed our lives a lot, and this is very difficult. Yesterday I was thinking what I was going to say about this. I might not be a very good example, but one of the things I'm trying to do in the last days is trying to go back to some things I used to do before the pandemic, such as exercise and I'm mainly working out and spending time with family and friends. Nevertheless, we are now in Peru with a third wave, so this is very difficult. But I guess I don't have much to say here unless you have something to ask or to share specifically. So I'm gonna stop now. Thank you so much for.
Yeah, that was.
Thank you so much.
Yeah, thank you. That was really great, and I really appreciated the various practical advice that you shared with the colleagues here. And you know, I think you did a really good job in terms of time management. So we have like over 15 minutes for us to engage in an informal discussion. So this is an opportunity to ask Dr. Menacho any additional questions you might have. So feel free to ask away.
Dr. Menacho, thank you for your insight and your presentation. I'm sorry, my video is off. The internet is a little shaky, but I just wanted to thank you for sharing your story. It's very inspiring. And I just wanted to ask about the social media, other ways of disseminating your research. What other ways besides your journal articles have you disseminated your research? Thank you.
Yeah, thank you, Scholar. Yeah, I mean, here in Peru, at least, thanks, I mean, because of the pandemic, the university, Cayetano, where I work, they launched a profile, a specific profile on Instagram and on Facebook for explaining to the population what's going on with COVID and later on with vaccines, and try to block like the fake news. And I think things like that, like having a strong institution in one country working on that, it is very crucial. Actually, our working group, fortunately, our university here has an important position. People, I mean, after some things that happen, people trust in the university, so it's good to use that, to use that power. And actually, in our working group as well, during the pandemic, we created some videos, for example, to share with the people on YouTube, on Facebook, on WhatsApp. We use a lot of WhatsApp here in Peru as they use in other parts of the world, such in Africa. So that's also a very good way to disseminate. It is good to have an institution or a working group with that people trust, because that make like the process much easier.
Thank you.
I don't know if you're welcome.
Thank you, Luis. We have one additional question from Ernesha. Can you talk more about the old idea, new idea grant resubmission process?
Yeah, thank you, Ernesha, for the question. Yes, what happened to me when I tried to apply for the very first time, it was a bad time for applying. That's something some years after that I said, okay, I shouldn't have applied. And someone told me at that moment, a colleague of mine told me if you don't have much time to do this kind of application, don't do it this year. Wait for the next year, because you won't even receive a score. And that what happened. Actually, I didn't even receive a score. And some years after, I opened the application and say, oh, what did I do this? How I could have done this? So she was right. I shouldn't have applied at that moment. you need to see if you are going to have the time, the time, like it took me like 4 months, almost full time to write the second new idea. Yeah, I guess you need to have time. You need to talk. I was lucky because Larissa, which worked with me, she had won 2 years ago the same grant, so she was very helpful. As I mentioned, Kimberly helped me a lot reviewing my grant. Yeah, the first time, what it was also a mistake the first time is that I worked alone in some way. I mean, I had my colleagues, my fellows, but I decided like, no, I'm gonna to write this because I had gotten some small grants in the past. So I'm gonna make it. I'm gonna make it. And no, I actually, the second time was everything different. I connected with the people I work with, and I delivered the amount of time it deserved.
Yeah, just I know we have one more question, but I think this is really important. The experience that Luis shared for K43 or any other grants. I think having enough time to really prepare for the proposal is really important. And what Dr. Menacho said was, you should feel open, and you should allow vulnerability in terms of reaching out to folks to support you with the grant submission process. And I think, Career Development Award and other grants, I think the main thing is you need to be able to tell a compelling story. So whether it's your research proposal or your career development plan, and you need to reach out to important colleagues to help you tell that story in a very convincing, compelling way. And the other thing is you shouldn't be afraid to face rejection. It's part of the process, and just because it wasn't scored the first time doesn't mean that it's not a good idea. So you just have to take it as an opportunity to learn from it, and then just be persistent and resilient. So really great point. All right, so Lourdes has a question. I wanted to ask if you're able to communicate and publish your work while working in non-academic settings, including working at the NGO.
Thank you, Lourdes. Yes, when I work at the NGO working with International HIV/AIDS Alliance, they had this network of linking organizations through which they actually created material and they shared internally among them. And at that opportunity, we created, for example, case studies, which are like 1 or 2 pages document in which you put like results or new strategies that have been implemented in this or another country. And you are able to share that. Sometimes it is something internal within their linking organizations. And also what I like to share is about, I'm fan of the videos for public health, and I have been involved in producing videos since a lot of time ago. And I think are very powerful. And we have used them for research, but also for health promotion. And we have worked a lot with communicators. In my career, I have been involved a lot working with communication and with communication people and with even productions, people doing voiceovers, and also myself, I have learned how to use a couple of video making tools through which I have done some small things that we have used in our projects.
That's great. Okay. Yeah, I love the full engagement we have with Dr. Menacho today. So, all right, so we have another question from, let me see, Aileen. Thank you for sharing your experience, and what advice do you have for the process of deciding the research question for a K43 proposal?
Thank you, Eileen. Well, I guess depends on the grant. There are some calls in which they don't care if you have experience or not in this specific area. I guess with a K43, you need to show that you're trying to do something you have been working on already. And yeah, I would start saying that. But then I have been before the K43, I have been working always on doing improving the continuum of care using technology, but mostly in the promoting HIV testing and starting HIV treatment among HIV positives. But then we found out that it was a problem with retention in the country. So in the process, you have to see what's the big gap. I mean, starting, yeah, for K43, it is a good idea to keep in the track you have been on already, and also looking at the gap you are trying to address. I'm not sure if that works, if that helps.
All right. Great advice. And Kimberly just says thanks, and excellent presentation.
Thank you.
So we have a few more minutes. Any other questions or comments? Just want to thank you for spending the time with us. This was really engaging, and I really appreciated you sharing your career path. And
thank you, Jay.
It's really, I think for our fellows, it's inspiring to hear a success story like yours. So I really appreciate it.
You're very welcome.